If you have ever felt that you have a ball stuck in your throat, even though you can breathe and swallow perfectly fine, there might be something wrong, something that you need to pay close attention to. This is a very common sensation, but it doesn't mean that it doesn't need a medical urgency attention. As a matter of fact, in some occasions, many of which I have encountered, these sensations of having something stuck in your throat could be the sign of cancer, a thyroid issue, or something as trivial as maybe not being able to sustain the emotions you have at a certain point in your life, and it could need medical attention. The very important thing is to know how to recognize what it is, and this is what exactly I'm going to teach you in this video so that you can prevent a more serious situation. So in today's video, I'm going to reveal to you what exactly it means to feel that you have a ball stuck in your throat, or a sensation like a sore throat or something that is stuck and you can't get rid of, and how can you fix it and make sure it never happens to you again. Your neck, what unifies your head with your entire body, is a very special part of your system. It's the part that contains most of the blood that is going to go right into your head. It's the part that is going to communicate everything your brain is commanding to your body and has to go through your neck, through those vertebrae, through that articular movement of something that is going to hold on to your head and your thorax. And it's also the place where your thyroid sits. It's actually the organ that is going to communicate how much of a metabolic rate you should be going through in order for your body to function. And this is extremely important because a lot of the functions, the bodily functions that happen in your body and that are communicated from your brain to the rest of your system, go and pass through your throat. But why do you feel that ball stuck in your throat sometimes, that hoarseness or something that is not normal going right between your cervical area and the front of your neck? Something is going on and you need to pay close attention. So before I continue, please make sure to subscribe to this channel, press that like and notification button because it really means the world to me. Maybe if I do say something that saves your life, the only thing you have to do is just press that like button. It's free. It's actually something that doesn't cost you a dime, and it can really be extremely beneficial with a little bit of information that is probably going to change the way you think and how you live. So having said that, let's continue. Number one, it might be just stress or anxiety. When we go through stress, we immediately go through a stress that is probably activating that fight and flight response. This will activate blood flow. It's going to activate the movement of our body, the contraction of our muscles. And guess what? Your throat already has muscles, and all that communication from your brain onto your entire body is going to go right through your neck. Your neck is going to be one of the first parts of your body to feel all that contraction of muscle, all that blood flow going up and down, making sure that you are oxygenated in your blood, in your brain to fight, to run, to whatever you have to do at the moment. And yes, you're going to see the tightening of muscles in your neck and your throat, and probably it's going to be harder in some occasions to swallow because guess what? When you are stressed out, your mouth dries off. You have less saliva. It becomes drier and you just feel that everything is contracted. And this might be something that you're living with every day and you are not even aware of. Chronic stress does exist. You might be in stress in that fight and flight response right now. You're not getting enough rest. You're always worried about money, maybe finances, maybe your job, your family, whatever's going on. And this might be one of those risk factors or one of those causes of feeling that strange sensation on your throat. So maybe you do need to relax, sleep well, make sure that you take some type of tea or supplement that can help you relax at night, get some good night's rest, 5-HTP, melatonin, maybe passion calm, or even neuromatrix, which will help you fix nerves that probably right now are malfunctioning. Number two, you might have a thyroid problem. I have patients all the time with thyroid conditions, right? Their skin is dry, their hair falls off, they tend to gain a lot more weight than usual. And one of those symptoms that really stands out to me and I see often is these type of patients come up and say, you know what, doctor, I feel something that is just stuck in my throat. Well, this might be the inflammation of your thyroid that is not functioning well. You might have hypothyroidism, hyperthyroidism. It doesn't really matter. It really does matter up to the extent of how inflamed is your thyroid and how you can have or what you have to do to fix it. Just so you know, the thyroid sits right in the middle, in the front of your windpipe. If enlarged, it can press and cause that throat pressure that you're feeling, maybe a lump sensation, or even the swallowing discomfort that you feel all the time and you can't get rid of, not even if you drink gallons of water, because the reality is that it might be an inflammation that you have to deal with. In this case, you might need supplements, you need nutrition, you need maybe to change your diet, stay away from wheats, breads, pasta, all these foods that are going to inflame or activate or cause a problem to your immune system. You might even see thyroiditis in the making, right? And at the same time, you need supplements that will help you, like metathyroid, neuromatrix, CarQ Health, or even melatonin from Fineland at finelandvitamins.com. Number 3, a silent acid reflux. Yes, the acid you have in your stomach can come up just right about to your throat and even to your mouth. We've all had that sensation, and it might be happening while you sleep, or maybe because you're overweight, you have too much fat in your belly, just pressing on your stomach is improving or impulsing the acid onto your throat. It's burning your esophagus, it's burning your throat, and you're just feeling that pain or that lump or whatever you're feeling at the time in your throat could be caused by an acid reflux that you're not controlling. Just so you know, your throat is more sensible than your esophagus, so you might be seeing maybe a common sign like throat clearing, hoarseness, chronic cough, or a globus sensation that doesn't go away. Deal with it. Make sure that you change your diet. Make sure that you're not eating citric foods or acids that are going to make things worse and increase the acid production. You don't want this, obviously. You don't want that burning sensation. You don't want to feel like you're not healthy. Look for something that can help you out to deal with this, to reduce that acid reflux, something natural that can help you, something like Ulcerate, Pylo Chase, GI Balance from Fineland at finelandvitamins.com. Number 4, it might just be that you are dehydrated. I see how people, I don't live like that, but I see people that put the AC on so strongly. It's just so cold inside, right? And a lot of people just love to feel that cold and feel that they could be in the Arctic Circle and don't really care. Well, guess what? Having that cold sensation or that dry sensation in the ambient you are attending to is going to dry your throat, and you're always going to feel something is not right. Well, it just might be dehydration. It might be dehydration because the place you live is probably too dry, or the AC that you're putting on is too high. Something is happening to where you're feeling that dehydration that is not going away. You drink water and it doesn't make it better. Well, maybe it's the way you live or the things you use. Maybe it's something that is actually not helping you at all fix the problem because there's something you love about the way you live. Check and see if this solves the problem. Now, you won't see it get better in just a day. You'll need about a week or 2 to get that hydration back into your system, your throat already humidified the way it needs. And by any chances or by any way you can, go ahead and drink lots of water to make sure that you keep yourself hydrated. At the same time, you're changing the things you need to improve. Number 5, pay close attention because it could be a tumor or a disease that needs treatment. I know so many people that have a symptom and won't do anything about it. They won't get themselves checked, or they won't care until the situation just grows out of control. And by grows out of control, I really do mean it. In some occasions, you might feel the growth of a tumor, of a nodule, of something that is not right, and you feel it just grow inside you, putting pressure on your throat, feeling that ball that doesn't go away. This could really mean that you need attention. Many of the tumors, cancers, and serious diseases we see with our thyroid or around them have to do a lot with really fast growth of lymph nodes, of thyroid condition, of nodules, and sometimes they're not good. So you may want to get yourself checked as soon as possible. Be very careful. And if you see any of the symptoms I mentioned today or any other symptoms that are probably not named in this video, get yourself checked and make sure that everything is okay. Don't forget to give us your like button, don't forget to share, and I'll see you in the next video. Take care.